and the village men help carry in the files of records and the medical equipment. The porch of a village house is the place where the clinic is held. The first task is immunization of young babies. 2 men of the village help keep the immunization records. The health worker, Shanta, gives the polio drink. Nurse Sarojini gives all injections and skin vaccinations, the vaccines that protect against whooping cough, diphtheria, tetanus, smallpox, and tuberculosis. Before the immunization and nutrition program began, nearly half the children of Bavi died before the age of 5. Now no more than 1 or 2 children die during an entire year. Of course, work with children is only one part of the clinic program. The nurse and paramedical staff handle all sorts of other problems. There are post-surgery cataract patients who come for checkup. Notes are taken so that a report can be made and the doctors can keep track of the patient's progress. There are many minor ailments that need attention too. The old woman is convinced that she needs a bandage on her wrist, and she gets one. In some cases, X-ray diagnosis is necessary. It's a long way to the hospital in Jamkhed, so the Aroles have converted an old cowshed into an X-ray lab. The young boy is suspected of having tuberculosis, and a diagnosis will be made. The X-ray equipment costs less than $2,000, and it serves an area of 20,000 people. Meanwhile, Shanta continues her home visits. The woman is pregnant with her 4th child. Shanta checks for anemia and swelling of feet and ankles. Is the patient taking her vitamins and minerals as she should? Have she and her husband decided that they will stop having children after this one? When Shanta begins talking about family planning and the tubectomy procedure, several women come in to listen. Some look skeptical, but the fact is that in several villages where the Aroles work, every married woman of childbearing age is practicing family planning. The secret? Immunization, better food, available medical care. The people now expect their children to live, not die. The expectant mother will go to the hospital in Jamkhed to have her 4th child and her tubectomy, confident that her children will grow up. What of leprosy, that ancient, fearful disease? It's hard to believe that this smiling man is a leprosy patient, one of 24 in the village of Bavi. Since the Aroles came, such people are no longer isolated and cast out. Their disease is treated like any other, and neighbors such as the village headman and his fellow farmer don't hesitate to visit them. The Farmers Club has organized a rehabilitation project for leprosy patients, giving them small herds of goats, which provide both a decent livelihood and that essential byproduct, dignity. The Aroles are convinced that community health does not exist in a vacuum. It is tied to social and economic well-being and to the productivity of the land. An untouchable farmer owned a piece of rough land that had never produced at all. The Farmers Club, which includes about 40 Bavi farmers from various caste groups, decided to level it, plow it, and plant it for the man.
Hey! Hey! Back! Hey! Back! Back! لا لا لا
Sitting together with an agricultural specialist and a social worker from Jamkhed, they decide that sorghum should be the first crop and peanuts the second. If there is enough water, there might even be a third. The leprosy patient is also getting help from the Farmers Club. His land needed leveling and bunding. The reservoir will furnish a good supply of water, and he can anticipate at least 2 crops. A third crop, this new spirit of community, is already springing up and flourishing in Bavi, and it is this that will ultimately change the face of the land. In the village also changes are stirring. It is evening now, and before darkness comes, Shanta and Lakshmi have one more assignment with the women, literacy class. Shanta herself had a hard enough time learning to read and write. Lakshmi has yet to begin. But here, sitting together at the end of the day's chores, is a group of women with a sprinkling of children, learning together the magic of chalk marks on a slate. As her visit to Bavi comes to an end, Lakshmi realizes that her eyes have been opened to new possibilities for her own village. This is what the Jamkhed program is about, the opening of people's eyes to new horizons of skill, knowledge, and health. Like the cataract patient whose new glasses replace his clouded lens, Lakshmi, too, begins to see life in a new way. Today, for the first time, the medical team is leaving for Lakshmi's village. She is ready. She has her kit and her teaching cards and a mind full of new thoughts. Now she will go home to share her knowledge and to bring her people within the circle of health spreading outward from Jamkhed. The sun is up. It's a new day.